Individual ergonomic interventions, fixing your chair, adjusting your monitor, have limited success if you're working within an organizational culture that fundamentally opposes movement and prioritizes sedentary work. What we need is comprehensive organizational change that makes health the default rather than something individuals have to fight for. The systems approach recognizes that health emerges from multiple interacting factors. The physical environment includes adjustable workstations, spaces designed for movement, stairs that are accessible and appealing, walking paths. Organizational policies include scheduled breaks that are actually taken, walking meetings as standard practice, flex time that allows movement during the day. Social norms where movement is encouraged rather than penalized, where taking breaks is seen as professional, not lazy, where health behaviors are modeled by leadership. And leadership commitment providing resources, modeling healthy behaviors, making manager support for employee health part of performance evaluation. The change management framework for implementing this is well established. Start with baseline assessment of current state. What are injury rates, ergonomic compliance, cultural attitudes toward movement? Stakeholder engagement, bringing employees, managers, executives, and HR into the planning process. Pilot programs demonstrating feasibility before organization-wide rollout. Scaled implementation with ongoing evaluation and adjustment based on data. Successful organizational models exist and demonstrate what's possible. Companies with treadmill desks and walking paths integrated into office design. Meeting-free hours that give employees time for movement and focus without scheduling conflicts. Ergonomic assessments for all employees at hire and periodically afterward. These organizations show reduced healthcare costs, improved employee engagement, and better retention. Metrics for success need to focus on meaningful outcomes. Reduced workers' compensation claims, which directly reflect injury prevention. Decreased absenteeism and presenteeism, indicating employees are healthier and more productive. Improved employee satisfaction and engagement scores. Retention of talented workers who would otherwise leave due to health problems. These metrics justify the investment and guide program improvement. The ROI documentation is compelling when done properly. Comprehensive wellness programs show $3 to $6 return for every dollar invested through reduced healthcare costs, improved productivity, and decreased turnover. Reduced healthcare insurance premiums when the workforce is healthier. Productivity gains from employees who aren't working through pain and fatigue. But you have to measure these outcomes systematically to demonstrate value. The cultural transformation required is significant. Shifting from sitting equals working to movement equals productivity. Moving from individual responsibility for health to organizational accountability for creating healthy environments. Creating workplaces where health is the default, where the easy choice is the healthy choice, rather than health requiring constant effort and willpower. For small organizations without large budgets, this might seem impossible, but there are feasible strategies. Changes like walking meetings cost nothing but cultural commitment. Encouraging breaks and movement doesn't require equipment purchases. Grassroots employee-led initiatives can create culture change even without executive mandate. Remote work flexibility can be leveraged to allow employees to integrate movement into their days. What concerns me is the gap between what we know works and what most organizations actually implement. The research is clear. The successful models exist. The ROI is documented. Yet most workplaces still operate with fundamentally sedentary, movement-hostile cultures that predictably produce musculoskeletal injuries and chronic pain in their workforce. The vision of a truly movement-friendly workplace isn't utopian. It's practical, evidence-based, and economically rational. It requires seeing employee health not as a cost to be minimized, but as an asset to be protected and enhanced. It requires organizational commitment beyond wellness theater to genuine structural and cultural change. For individuals and organizations that aren't there yet, the path is advocacy combined with personal action. Advocate for organizational change while implementing what you can individually. Find allies among colleagues. Document the costs of the current sedentary culture. Pilot small changes that demonstrate feasibility. And ultimately, recognize that some organizations will change and some won't, and choosing to work for an employer that genuinely prioritizes health is itself a health intervention.